How air pollution fuels the asthma pandemic among children. Infants and children are extremely sensitive to air pollution. A 5-year-old child inhales about 25 litres of air each hour and more than 600 litres per day, much more per kilogram of body weight than an adult. As a result, substantial quantities of inhaled pollutants can be deposited on the delicate membranes that line children's respiratory tracts and lungs. With their immature immune systems, children are also much more likely than adults to contract upper respiratory infections, which cause sneezing and runny noses. Their developing respiratory system and lung function are also compromised by both indoor and outdoor air pollution. Children living downwind of pollution sources, such as polluted city streets, major roads, or factory smokestacks, are exposed daily to elevated levels of air pollution from these combustion sources. Weather systems can carry a mix of pollutants from factories and agriculture, including heavy metals, toxic chemicals, and pesticides. Combustion of heavy fuel oils in furnaces is an additional source of urban air pollution. These heavy fuel oils, which are also known as residual fuel oils, are the remnant from the distillation and cracking process of petroleum, that is contaminated with different compounds including solvents, aromatics, sulfur, and nitrogen. Inner city air pollution is caused primarily by petrol and diesel exhaust emissions from motor vehicles such as cars, lorries, and buses. Fine particles of soot and irritating and toxic gases produced by combustion, when exposed to sunlight, react with oxygen to produce a toxic smog containing carbon monoxide, nitrogen oxides, sulfur dioxide, and ozone, which are well-known irritants to the lungs and respiratory system. During the steamy, hot, still days of summer, levels of airborne pollutants can be exceedingly high, especially during the daytime when ozone levels peak. As night falls, the ozone levels decrease, but the fine particulate pollution often remains. So, the bad air can extend well into the night and during periods when other pollutants diminish. Some of the particles are small enough to penetrate deep into the lungs and can be transported into the blood, carrying a toxic mixture of sulfur oxides, heavy metals, and other noxious materials directly into children's bodies. Indoor air pollution can contain high levels of cigarette smoke, as well as the combustion products of poorly ventilated household stoves, furnaces, and fireplaces. When a house is well ventilated, the levels of indoor air pollution approximate those of outdoor air pollution, but when a house is closed up for heating or air conditioning, the indoor air pollution levels rise, especially if there is a smoker in the house or a poorly ventilated stove or fireplace. Exposure to indoor or outdoor air pollution can have an immediate effect on a child, causing wheezing and shortness of breath in children without asthma and causing increased frequency and severity of asthma attacks in children who already have asthma. Furthermore, air pollution can also cause bronchitis and pneumonia in children. In fact, the end result of air pollution when it comes to children is always an increased number of school absences and hospitalisations. Here are some of the effects of air pollution on asthma. A. The more severe the air pollution, the greater the number of asthma cases. B. Infants who are exposed to fine particulate air pollution have a greater chance of dying from sudden infant death syndrome, which is also known as crib death. C. A woman exposed to air pollution during her pregnancy has a greater chance of having a premature delivery or a child with low birth weight. D. Children who are exposed to secondhand cigarette smoke have a higher rate of asthma than those not exposed to cigarette smoke. E. Inner city children who are exposed to high levels of air pollution from motor vehicles and industrial sources have higher rates of asthma and respiratory disease hospitalisations than children in areas of low air pollution. Reducing air pollution, even for a short period of time, reduces the number of hospitalizations of children due to asthma or respiratory disease. A few notable studies done in cities hosting Olympic Games have definitively shown this. For example, a study done during the 2008 Summer Olympics in Beijing, China, found that reducing outdoor air pollution, even for the short 2-week period during the Olympics, resulted in fewer hospital emergency room visits by patients with asthma. Long-term reduction in air pollution can have great benefits for children's health. A study in Los Angeles in the United States showed that, between 2001 and 2008, as levels of air pollution came down, there were fewer pediatric hospitalizations for asthma than in previous years. When pollution rates were higher, there were more children hospitalized for asthma. The increasing rates of pollution in today's world are not good news for children with asthma. Added to that burden is the fact that some of the pollutants already released into the environment are persistent environmental pollutants that will remain in our bodies and in the bodies of our children and grandchildren for decades or even generations. Annual surveys done by the Centers for Disease Control and Prevention in the United States show that most people today carry measurable amounts of approximately 200 manufactured chemicals in their bodies. Some of the chemicals to which we are all widely exposed can tinker with our normal bodily processes, which may result in a plethora of silent and overt acute or chronic illnesses. Copyright Academy House www.academy.house